Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Woo! Hey, Dr. Miami.
Hey, Mavi. Hey, Mavi.
Mavi. Hi. I'm super excited to have you on the podcast today. You're like the OG of plastic surgery on the internet. So I wouldn't be here if it hadn't been for you in Snapchat. So thank you.
Thank you. Thank you. Thank you for acknowledging my stupendous contributions to the field of plastic surgery.
Amazing. If it hadn't been for you, I think a lot of the stuff that went on wouldn't have gone on. So I think you deserve a lot of credit.
100%. I don't really deserve any credit because it was just like a lucky thing that I happened.
You're right. It was Brittany.
She got me. No, it was just a lucky thing that I went on Snapchat and Instagram and all that. It wasn't like some grand scheme that I thought of. It was just some of the girls in the office said, you should try Instagram. And I pushed them away for years. Like, no. And then finally I went on and it blew up. And then when the Instagram got taken down briefly, my daughter said, try Snapchat. And I was like, what's Snapchat? I don't even know what that is. But the girls in the office did, and they just did it for me. So basically, I'm like a puppet, and I'm like being puppeteered. And Santina's my new puppeteer.
Well, she does a great job. I love her.
Isn't she?
Thank you. You do a great job, Santina. And Dr. Miami, you were the OG really bringing on the surgery into social media. And you led the way for a lot of us, I think, out here.
Thank you. You know, I had no idea that there was such an interest in seeing like the gory nitty gritty of plastic surgery with the blood and the guts and the bandages and everything. But I guess there was, everybody sees like on TV and in movies, the surgery part, you just see like the surgeon's face and you don't actually see the actual, like what they're actually doing. So yeah, that's kind of what I did. I showed the nitty gritty.
The nitty gritty, and patients love it. They like to see it. I actually have this question that I ask my girls, like, how far is too far? What do y'all want to see? What do y'all not want to see? Like, when is it? Are we pushing the envelope a little too much? And they love seeing everything.
Yeah. And the funny thing is a lot of people, when they start watching surgery in the beginning, it makes them a little queasy or they get lightheaded. But then after a while, they can like eat lunch and
while they're watching
like a tummy tuck split open and stuff. So you get desensitized to it. And I think it's good because it allows patients to really understand the process. It's not a mystery anymore.
Exactly. And, with my show, what I like to do is walk them through recovery. So it's not just knowing so much about the surgery, but girl, how are you going to recover from that?
Recovery is, at least half of the plastic surgery experience, and unfortunately, a lot of the plastic surgery industry, surgeons, practices have not paid enough attention to that, I think, and have not focused their practices enough on making the plastic surgery recovery experience both, enjoyable, pleasant, survivable, and like designed to give the best results. So that's kind of where I've shifted the focus of my practice over the last, I'd say 4 or 5 years. Anyone can do the surgery. Not anyone, but any surgeon can do the surgery. But making sure that your patients are safe and responsibly taken care of afterwards is not so easy. So I will just tell you a little hint of like what we've worked towards over the last 5 years. So it used to be, and in many places still, a patient would have like a liposuction or a tummy tuck and they go straight home, right? It's an outpatient procedure. They would be kind of told a little bit in advance, okay, you might bleed on your sheets. So I don't know, put out some towels or some, chucks or something. But they don't really have a concept of what that means until you're going through it. I mean, it looks like an episode of Dexter.
Yeah, it does.
So a lot of times the patients are unprepared. The husbands or partners are certainly unprepared, right? And they suddenly have to start playing nurse, or like YouTubing stuff and Googling around. And oh my God, she looks like she's dying. And people pass out after surgery very commonly. The first couple days, they get lightheaded when they stand up, all that stuff. So that is, let's say, that's like the standard of care right now, unfortunately. One step above that, which is what we did from like 2010 to 2015, 16, is we'd send patients to what's called a care house or like an Airbnb with a nurse, which is a little bit better because at least they're not going home, you know,
and professional.
And they're with some kind of professional. And usually it was like an agency person. It wasn't necessarily a person that was trained by the specific surgeon. Protocols would differ from surgeon to surgeon, from patient to patient. And sometimes they're all lumped together. And one doctor likes it done this way, another doctor likes it done that way. So it wasn't really uniform or standardized. And the quality control was lacking. So what we've moved towards is the last 5 years is we contract with a hotel and we take a whole floor in a hotel for our patients. And then we have nurses there 24/7 that we train, that we hire, that are under our supervision, that we're responsible for. So that allows the post-op recovery process to be standardized, uniform, and have some quality control in it. And it's just been wonderful. Obviously, there's a little bit more of a cost to it. But like I said, that first week is critical. Critical to results.
Absolutely, yeah.
Critical to safety. Critical to how you remember the operation, you know? And so that's what we move towards. Beyond that, once you go home, you know, it depends on the operation you have. But I like to follow up at least once a week for the first month with every patient. And then once a month for the first 6 months, and then every 6 months, and then once a year. You know, it's a long-term commitment, plastic surgery, between you and your surgeon. Yeah.
Forever. Once you commit to having your surgery, you are committed to maintaining those results forever.
Forever. You know, one of the good things about social media is being able to show people in the operating room, post-op, and then months later, people can see that it's not like a quick fix. It's not a miracle. I mean, it looks like a miracle, but you have to maintain it. You know, it's like taking a shower, you know, you don't do it like once a month, you know, you don't think about it once. No, it's like you have to continuously maintain your body and your results so that you heal well and that you get your bang for your buck.
Absolutely. You know, what's so interesting when I was reading your prep sheet, and I like to ask, let me tell my girls, I like to ask my surgeons what their favorite procedure is. So I asked Dr. Miami, what's his favorite procedure, which your reply is completely different than what I thought you were going to say, because you are literally like the BBL king. Hello, she went down to Miami just to see Dr. Miami.
Yes.
So how did you go from your favorite procedure being rhinoplasties to being the BBL king?
It's a very good question. So the rhinoplasty for me, I say it's my favorite procedure because it is the most challenging, the most humbling. And I think psychologically, it's the reason I went into plastic surgery. Remember, late 80s, early 90s, there was no BBLs. There wasn't even like a thought of how to make butts bigger, what to change shape. It wasn't even like a thing. But rhinoplasty was a thing. And I had a big nose growing up, like a big nose, big, like Olympic size.
We need to see pictures. Santina, we need to see pictures. They've
all been burned. See, luckily, I grew up in the age before smartphones. And so there's maybe like 6 pictures of me before the age of 18 in existence. They're all like on real paper. So sorry, those are not happening. But definitely lent an insecurity to me. And it's definitely the reason I went into plastic surgery. No question about it. Like the idea that you could change the way you feel about your body, change the way you look. It's so cool to me. And again, from a personal perspective, that I just always wanted to learn how to do it, you know? So that's the reason. It's personal. It's also from a professional standpoint, like I said, it's a very humbling operation because you can do 10,000 noses. Every single one is different. And every single one like ages differently. Like it can look great at year 1, 2, 3, 4, 5, but like 10 years later, does that nose still look good? It's hard to know because it's like, again, extremely challenging. And so, yeah, butts are fun. And okay, I'm not going to lie. I'm really good at it. Okay. But again, and I'm not saying every 2 butts are exactly the same, but it's not the same nuance. It's not the same level of like detail. In a nose, every millimeter counts. And it's something that people see every single day when they look in the mirror. You know, it's like who you are in a lot of ways. So yeah, that's why.
Yeah. I love that. That's awesome. I think,
Well, yeah, you are your nose. You are your nose. Absolutely. Especially if you have a big nose. Because it's like when you leave the room and people are like, who was that? I mean, the guy with the big nose? Oh, yeah. His name was Michael. No offense to anybody who has a big nose, but I'm just saying I've been there,
You know what? That's so interesting. So after you had your own rhinoplasty, you felt the change, right? Like within yourself.
Oh, unbelievable. Unbelievable. It's like, and not only that, and anybody who's ever had any facial plastic surgery can tell you this. The first couple of weeks when you look in the mirror, it's very confusing almost because you almost don't recognize yourself. Like you have to do a double take. Like you really do a double take. Like when you pass a mirror, you're like, who's behind me? Who is that? Like, oh, that's me. Or like you're driving along, you look in the rearview mirror and you look up and you see your profile. And it's like,
who is that?
Who is that?
The new you.
Who is that handsome man? Is that Tom Selleck? I just dated I just dated myself right there.
That's hilarious. It was a whole new you. You saw yourself in the mirror and you're like, this is the new me.
I can't believe I referenced Tom Selleck. Wow. Wherever he is, God bless you, Tom. Is he still alive? He's not alive?
Is Tom Selleck the guy who's the Super Bowl player?
I don't know who he is.
He was Magnum PI. He was an actor, a big actor in the 80s.
I never watched that show.
Three Men and a Baby. He was like the definition of like handsomeness in like 1985.
That's hilarious. So, okay. So I think it's so cool that you really did start this like going online, showing surgery. Yeah. And I feel like you really were the trailblazer in all of this. Yeah. So I'm curious to know, how do you feel about like the continuance of it and how other surgeons have done it, but there's been other situations where it hasn't been safe and they've gotten themselves into trouble?
Yes. The first hint of that, I remember like 2015, 2016, there are a lot of people coming on doing Snapchat and doing social media in elective medical fields, not just plastic surgery, orthopedic surgery, dentists, anything, dermatologists. And obviously, like imitation is the sincerest form of flattery. So it didn't bother me at all. I was like excited that people were starting to do it. One of the funny things is in the beginning, when I first started doing it, I got a letter from the American Society of Plastic Surgeons, basically kind of like a warning letter, like, we don't think this is so great, et cetera, blah, blah, blah. Be careful. And then a year later in their like monthly trade publication, their like journal that they put out to all the plastic surgeons, they started a social media section in their journal to address it. So like, that's how much the game changed in 1 year, from like almost like a slap on the wrist to like, okay, we're getting behind this. This is the future. So that was really nice for me. But to go to the point of people pushing the envelope, yes. I mean, I remember there was some dentist or something in Alaska who was like on a hoverboard pulling out teeth on Instagram or Snapchat. He ended up like going to jail or something. And like,
yeah,
there was a line between when you're in the operating room and when you're doing surgery, you have to be a professional. Do you know what I mean? I don't 100%. Care. That doesn't mean being professional doesn't mean the kind of music you listen to. It doesn't have to be classical music. It could be rap, whatever you like. But you can't be on a hoverboard and operating. Do you know what I mean? You can't be, doing things that are unsafe for the patient while they're asleep. On the other hand, I see no problem with showing your goofy side outside the operating room, or even with the patient. If the patient's goofy and you're having fun on TikTok or having fun on Snapchat or whatever, there's absolutely nothing wrong with that. It's not unethical. It's totally fine. It's you being you.
It's perfectly fine.
And in my opinion, it makes the relationship between the doctor and the patient a lot more sincere and a lot more transparent and a lot more human,
Absolutely. Because would you agree that like, if they don't like it, they just don't come to you. But the ones that like it, they love it and they come
100%,
to you.
100%. And it's not for everybody. Some people still want a doctor in a white coat, all buttoned up with a clipboard that's going to basically kind of be like very paternal, like, this is what you need. This is what I think, and, all my colleagues here, hold on, I'll put on my paternal glasses here. That all my colleagues, at Harvard would agree that this is the proper. Do you concur? I concur. That's fine. A lot of people, that's how they want their doctors, but not everybody wants that, especially when you're having elective surgery. And plastic surgery is not like getting cardiac surgery. Okay. It's not like getting your appendix taken out. A, it's not an emergency. Okay. And B, you're extremely vulnerable, extremely vulnerable. I mean, not many people like to take their clothes off in front of anybody, right? I mean, probably like less than 10% of people, I would say, are comfortable just getting naked wherever they are. Very few. And the fact that you're coming to a surgeon is you're admitting, okay, there's something I don't like about myself, my body, my face, my body. There's something, and I've tried to change it in the gym, whatever, diet, it didn't work. By the time you get to the point where you want to see a plastic surgeon about it, it's not like a split decision 99% of the time. It's something you've thought about. And now you got to make the appointment. And now you got to show up. And now you got to meet a stranger and you got to get naked or talk to them about your deepest insecurity. I don't like my nose. I don't like my ears. I don't like my breasts. I don't like my penis, whatever it is. Okay. I think that you want the person who you're talking to be a human being, and to have a personality and to be able to empathize and feel, as opposed to the cardiac surgeon that's going to be, you just want like a mechanic to go in there, change the valve, change your oil and get you back on the road. You know what I mean?
Right.
And like I said before, when you take somebody's appendix out, that's it. Their appendix is out. They go on with their life. But like you said before, plastic surgery is a lifetime commitment. You're in your body. You're presenting your body to the world. You have self-esteem issues. You have, good days, bad days. That's a forever thing, and the commitment between you and the surgeon is long-term.
Absolutely. And that's why it's so important. I always harp on this. I tell my girls that my number one thing when you're looking to start your plastic surgery journey is to find a surgeon that you trust and that you 100%. Like 100% trust this person to do your surgery. Because that's like the number one. If that's not there, then everything else is kind of
not just the surgery. And not just the surgery. It's after the surgery. Where are they going to be after the surgery? Are they going to answer your calls? Because, if you've been in the plastic surgery field any amount of time, you'll know that about 10% of plastic surgery does not come out perfect. 10%. 90%, awesome. 10%, there's going to be a little bump in the road.
Something.
A stitch comes out, but I mean, like, not like you open up, like unravel like a sweater, but I mean, like, a stitch doesn't dissolve. It comes through the skin. You have a little infection. The scar doesn't heal right. You have a dog ear. You have some asymmetry. I once had a lady literally leaving, going from the hotel to the airport. The cab driver accidentally, they're fighting over who puts the bag into the trunk and breaks her nose, like elbows her in her face, breaks her nose right after.
Oh my gosh.
Shatters it. So things will happen. Is the surgeon going to be there for you afterwards? And, I pride myself on the fact that I give my patients my cell phone number, not even after the surgery, but before the surgery. So they need questions. They text me. Sometimes people freak out before the surgery. They panic.
Exactly. It's anxiousness. It's nervousness. What's to come? Like I just did an episode where I'm like, how do we calm our anxiousness? Educate yourself about the procedure. Make sure you pick a good surgeon. Start doing some meditation. Start working out, journaling. Like get your mind straight before you go under the knife.
Yeah. It's like running a marathon. You need to prepare.
Absolutely. Prepare. You know what's so funny about the letter you got? I actually took your course at ASAP's, your marketing course with, what's her name?
Rosie?
Rosie. I took Rosie's class. I took Rosie's class at
Rosie's
ASAP's
great.
a few years ago.
Rosie's great. Yeah, by the way, she's the mastermind. Santina's also a mastermind, but like I wouldn't know where to start with social media. What am I? I just referenced Tom Selleck. Okay. Just think about that. Right. Definitely wouldn't have 2 million followers on TikTok if I was just on my own.
Right.
But again, at the end of the day, the point is to educate patients and to like inspire patients and let them know that there's options and there's a way forward in this journey.
Absolutely. And would you agree that some of the people that follow you are not even really interested in surgery? They just want to follow you because you're fun.
Yes, that's true. But again, that's not just me. It's me. It was Brittany and Ashley and Megan and Santina and Rosie, You
have a nice team. You have a girl gang behind you.
Yeah, I have a girl gang. It's a fun place. It's like 5 out of 6 days. It's a fun place to work. No?
Are we here for 6 days?
No, we're not here 6 days. That's why I said it like that.
Okay, good. So most of the time it's good.
I would say 1 out of.
Oh, come on. No, it was fun. It definitely, it's not a coal mine. You know what I mean? It's not
It's
like
fun.
dreary.
Yeah. I
But
love
I
the
have my moments. I have my moments. I'm kind of like a chef, like if the food doesn't come out right or something goes, I get like a little pissy, you know.
normal. Sounds like a normal surgeon to me.
Like the chef from the menu.
She said, I'm like the chef from the menu. Get me my gun. A little bit. It's fun. It's fun working here. But, at the end of the day, there does need to be discipline. And you do need the surgery and the patient care is number 1, 2, and 3.
Number
and then
one,
the TikTok is fun.
Yeah.
Snapchat is fun and all that.
I'm super curious because I remember when you started, you were on Snapchat, right? You were hitting it hard on Snapchat, going big. And then all of a sudden there's like, you're training surgeons on how to do with BBLs, how you do them. So how did that all it just started happening? How is it now? Tell us about it.
So the first, it's funny because you never forget your first, right? So we were on Instagram and there was this other surgeon from Minnesota, Dr. BBL. And he's like, I don't think he was called Dr. BBL at the time, whatever his name was. And he would like our stuff and comment and send messages. And like your first instinct in the beginning, because in the beginning, when the Instagram Snapchat was blowing up, there were a lot of haters in plastic surgery. They were like, they'd be reporting stuff. You're violating, whatever, violating, man. You get stuff taken down and whatever. So my first instinct was to block him, like block them. They're probably reporting us or something. But he was, to his credit, persistent and reaching out, and just a really nice guy. And so through that first person that broke through the wall, he came down. We talked about social media. We talked about BBLs. He was really passionate about BBLs. And then from there, it just, once you train one person, it goes, And then it was it's like 60, 70, we have a whole organization now called the World Association of Gluteal Surgeons.
I didn't even know about this.
Yeah. And it has between 300 and 400 surgeons around the world. And we have this amazing WhatsApp chat group where it's super active. You can't put your notifications on. It's that active because it just keeps you up all night. But it's just surgeons all over the world helping each other,
Wow.
Yeah.
I love that.
And the organization was started originally just because I wanted people to learn how to do it safely and to basically because, it hurts everybody when there's, God forbid, a death or something like that. So it behooves everybody who does this to make it as safe as possible for everybody. I think in the long run, that's going to be my biggest contribution to patient care and safety is just being able to form organizations that train other surgeons.
I love that. That's inspiring to me, for real, because it's very helpful to patients who are afraid of going into surgery because of that. They're afraid of
course, and they should be. And they should be. People always ask me, is the BBL dangerous? And I'm like, the question is is a car dangerous? Yeah. I mean, if you're drunk and you're on the wrong side of the highway, yeah, of course it's dangerous. On the other hand, if you're experienced, if you're well-trained, if you're careful, it's no more dangerous than any other operation and less dangerous than a lot of operations that people do all the time.
Oh, people say, it's the most dangerous surgery, the most dangerous plastic surgery. But I thought that was tummy tucks.
It is. Yeah, tummy tucks is still the most dangerous plastic surgery. Not because of the surgery per se, but because of the risk of pulmonary embolus afterwards, immobility, blood clots in the legs. So that actually is what keeps me up at night more than anything else, is the things that you can't control in the operating room that can happen afterwards. That's another reason I keep patients in the hotel. So what I do, I have a full-time ultrasound tech, and it's a little nuts. When I tell other surgeons about it, almost nobody does this, maybe 2 or 3 in the whole world. I have a full-time ultrasound tech. Her only job is to scan patients' legs for blood clots. She does that the day before surgery, the day after, and 1 week after before they fly home.
Wow. I had no idea you were doing that.
Yeah. And I've been doing that for a couple of years, maybe 3 years.
Because blood clots that's out of what you can do, out of what the patient can do.
You put the stockings on, you put the SCD boots on. We give them the SCD boots to take home and on the plane and everything else. But even with all that, you can't make the risk zero. The only thing you can do is detect the clot early and treat it. Now, another approach, which is not the right approach, not the right approach, is to anticoagulate everybody. Put everybody on blood thinners. Not the right approach. I'm saying it right now. That leads to bleeding, hematomas, problems. And there's even a case, and I know this because I just spoke with a surgeon who testified at the trial to try to defend this surgeon. Okay. There's a case where a 35-year-old lady went in for a tummy tuck. No other risks for blood clots. Okay. The surgeon decided that he's going to anticoagulate everybody in his practice. She went home after surgery and unfortunately bled to death.
Oh my goodness.
Right. In her house. It's horrible. Right. So you can't anticoagulate everybody because you'll have a certain amount of people that will bleed. Right. And then you can't just let people go and just hope for the best. You have to do something, I think, to like intervene. But so I don't like change, which is a really a good thing in surgery, you know, because consistency and being able to do the same thing over and over again, which not everybody can do. You know what I mean? A lot of people like variety and changing things up, but you really do have to do the same thing over and over thousands and thousands of times to get good at it.
To get really good at it. Yeah, absolutely. Mm-hmm. Yeah. I totally agree. So now with your practice, are you still doing a lot of BBLs? Are you moving towards other surgeries or
no? I think I've hit my sweet spot, which is basically and at this point it's all women between the ages of 18 and 50. I don't operate on people over 50 or under 18. And it's like 90% mommy makeovers, you know, breast lifts, tummy tucks, BBLs. I love doing the weight loss surgeries, brachioplasties, thigh lifts, arm lifts, combinations. I love what we call it the new body who dis operation, which is in everything. It's so amazing. I mean, I just took bandages off a patient today at the hotel and she was crying and I was like, a little teary eyed. It's just like so nice.
So beautiful. Isn't it such an amazing feeling
I live vicariously through that. Yeah.
Me too. I tell my girls, like, your success is my victory. Yeah. You loving your results and feeling happy and going off to live like
it's great.
Your new life.
I'm almost a little jealous, honestly.
Because they get to go start a new life.
Yeah, because like to be able to go to sleep one way and like wake up a complete like, you know, I can't even imagine what that must feel like. It's like winning the lottery.
Feels like a dream. You wake up and you're looking at I've had my surgery 2017 and I still sometimes I will like after I've been working out and eating really well and my abs are coming and I'll look in the mirror and I'm like, oh my God, I can't believe this is me. Like this is me now. And I interviewed
who is that handsome guy in the mirror?
Yeah. It's such a good feeling.
It is. And like I said, I'm jealous because it's like, it really, you can see the happiness, you know, the joy, and it happens really fast. And it doesn't happen for everybody. And I don't want to misrepresent plastic surgery. Sometimes it's just a little thing, you know, but when it's like the worse it is to begin with, the bigger the change, the more benefit you get from it, the more drastic the improvement, the happier people are. So that also makes me happy. Like sometimes people will come to me and send me their pictures after they lost like 200 pounds. And I get so excited looking at them naked. They're like, why are you so excited? I'm like, no.
You don't know what's possible.
I'm like, I see what's in there. You know, I see what's underneath the skin. I see the breasts in the right place. I see the shape. I'm like, you have a beautiful body. Like you have a beautiful frame. Like it's going to look awesome. They don't yet see it. You know what I mean? They just all they see is skin and everything all a mess. I had one lady go to me half jokingly. So doc, is it a total loss? Is the body, it's like a total loss, like a car. Like I just junk it and sort of, I'm like, no.
No, we have hope. There's something I can do.
Are you kidding me? Yeah. I'm like, are you kidding me? We're just getting started. Yeah.
That's awesome. I am so happy I had you on today, Dr. Miami. This was amazing. Getting to talk to the OG BBL King. The reason why this is even here.
Big butts, no lies.
Big butts, no lies, because you were the trailblazer.
Thank you. Well, thank you for having me on. Really nice talking with you. And say hi to Santina.
Santina, you were the reason why Dr. Miami landed the interview.
Yeah. Period.
Thank you for saying that. Say it one more time. He's old. Sometimes he doesn't get it.
I can't hear well.
You might have to hear it again.
She does so good on your social media. On your TikTok, the red wedding, that was it. Whose idea was that?
Hers. All's hers.
I love it. I love it.
Even the bad ones are my idea, but I tell people they're his.
Some of the bad ones are my idea. Some of them. Actually, my ideas are so bad, she won't even sometimes she'll record stuff. And I'm like, no, you got to do it. There was one the other day where I'm like, smack me. And then I had Tic Tacs fly out of my mouth, like my teeth were knocked out on the floor. I'm like, that's so funny. She's like, yeah. No, not happening.
But he wouldn't stop. We had to record it.
I'm like, no, record it. It's going to be really funny.
And then he was like, can you post it? I'm like, yeah,
tomorrow. It's like 3 weeks later.
She's like, it's in the backlog. We'll use it when we don't have anything else to post.
It'll never see the light of day.
No, it won't.
But anyway, I made it, but it's funny to me.
I love it. You guys are amazing. I love watching y'all on TikTok, and I am excited I had you on, and I'm thankful that you guys came on.
And I thank you for having me, and thank you for directing patients, to explaining them, educating them, and, cheering them on the journey.
I try my best to educate them as much as I can and send them to...
Wait, but I cannot get off this podcast without mentioning the semaglutides, Mounjaro and Wegovy, those new injection medications for weight loss. They're miracles, and everybody should be on them on their journey before plastic surgery, they're overweight. Start taking them. That's all I wanted to say.
Okay, wait. Well, I have a question though. So have you had patients who have been on it and then come see you?
Yes.
Do they have to get off of it for a certain amount of time before surgery?
No. Take it right through.
Right through. Wow. Okay. So I actually have a bunch of girls on it right now. So y'all heard.
Take it right through.
Awesome.
Okay. All right.
Thanks so much, Dr. Miami. Bye. Bye, Santina.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.